We should get started. Good afternoon, everyone. Thanks to all of you for being here, 3 p.m. In the afternoon on a day like this. And certainly believers, we're believers here, so great to see everybody. So I have a great collection of folks here with a lot of different sorts of experiences, eventually ending up on the corporate venture capital side. So anything and everything you want to know about corporate venture capital and so forth, how you might interact with the groups here that are represented here, etc. We'll hopefully cover some of those questions you might have. And of course, ideally this will be interactive, so at any point, if any of you have questions, just raise your hand, let us know. I'm sure we'll have folks here who will be happy to answer those questions. So to get started, I'll start off with the opposite end of the table. Just brief introductions that folks can provide about themselves and about the groups that are represented here. So start with Vijay from Johnson & Johnson Development Corp, which is part of the innovation efforts that J&J is leading.
Great, thanks Rajiv. So I'm Vijay Murthy. As Rajiv said, I'm part of the venture investment team at JJDC. Focus on pharmaceutical investments, but my colleagues also do medical devices and consumer. We are, as Rajiv mentioned, we're part of the broader umbrella organization, Johnson & Johnson Innovation. So you can think about, there's really three pillars under that. So there's us. We were the oldest healthcare corporate venture capital firm, been investing for 44 years. Strong team management commitment to what we're doing. Second piece is our innovation centers. So we have groups based in Menlo Park, Cambridge, Boston, Shanghai, London. Really our early stage business development collaborations group. And then the third piece is our J Labs. Those are the no strings attached incubator. Many of you in San Diego might be familiar with that. We have a site here, a site up in Mission Bay, South San Francisco, Toronto, opening one in New York, as well as Houston. And so those are opportunities for folks to kind of come in, get access to space, really prove out a technology, and then have an opportunity to kind of raise a larger round of venture investments. For that, we don't take any type of rights or obligations to invest. We want to just build a relationship with you. So those are kind of three ways that we look to tap into the external ecosystem, JGDC, our innovation centers, as well as JLabs.
My name is Vikram. I work with one of India's largest pharmaceutical companies called Cipla. It's a generic company looking to get into the branded space. So, by way of background, I'm a geneticist and a neurobiologist by training. Did a lot of commercial work in the US, including drug launches, and helped set up a transaction service as well in my past experience. Most recently, I've been at Cipla for about 4 years now, and I'm heading innovation for Cipla, trying to help the company transition from a generic company to an innovation company. Venture capital just happens to be one of our tools. In addition to venture capital, I'm also in charge of building the company's pipeline and also engaging in transactions, licensing deals, as well as mergers and acquisitions. So I look forward to telling you a little bit more about our company, about the way we do venture, and how we look to interact with small innovators.
Great, thanks.
Elaine Jones with Pfizer's Venture Investment Group. Pfizer is a strategic investor in every company that we target for equity investment. We have two pots of capital. One runs under the Pfizer Venture Investment rubric. Again, we are looking to invest in companies, stage agnostic, and working in areas that are of interest either currently or future to Pfizer. And we have a second pot of equity capital called R&D Innovate, in which equity investments must be championed by a chief science officer within Pfizer's R&D organization. In both cases, we do not use equity to purchase a partnership. Our equity is, I think as Vijay said, is strings. There are no strings to it, but in some cases we do have a collaboration alongside the equity piece that we're making, investment that we're making in the company.
Andreas?
Hi, my name is Andreas. I'm with Merck Ventures, the strategic global venture fund of Merck KG. So in the US we actually call it M Ventures, as some of you might be aware of the name. Difficulties with the two Merck in the world. Merck Ventures is the strategic venture arm of Merck KG. We have 4 teams. We have a healthcare team focusing on drug development, We have a life science team focusing on anything that is not a drug or not yet a drug. That's my team, so I'm a bit the weird one in the panel, because I'm not investing in drugs. We also have a performance materials team, because Merck is the global leader in liquid crystals, for example. And in addition to that, we have a new business team focusing on digital health and other technologies. We started a new fund structure last year, so we already used to have a healthcare fund since 2009, with an active portfolio of roughly 30 companies in healthcare. And last year we started with 3 additional funds: life science, new business, and performance materials. It's a 300 million euro evergreen fund. We are early stage focused. We are globally active. We have offices in Boston, the headquarters in Amsterdam, but also offices in Darmstadt and an incubator in Israel. And strategically, we are linked to Merck, but operationally, we like any other VC. But we do need an initial buy-in on the strategic level, but then when we operate, we do pure equity investments and no strings attached.
Great, thanks, Andreas. And I'm Rajiv Dadu with a group called SR1, which is the venture investment arm of GlaxoSmithKline. They're structured as a somewhat independent entity, hence the separate name and so forth. So like with JJDC, we've also been around quite a while, so over 35 years now investing in the healthcare space. Most of what we invest in does tend to be biotech companies, companies that are discovering and developing novel drugs. But selectively, I would say 10 to 20% of our investments are also outside of biotech in terms of devices, diagnostics, health tech, digital health, and so forth. Truly looking for transformative opportunities in those kinds of spaces. So I'll stop here. Maybe we'll go through 3 or 4 sort of basic questions that some of you may have, at least in terms of how the corporate venture groups represented here works, what some of the differences might be with other parts of the parent corporation, and so forth. So just we can go through the panel members. Maybe Andreas will take the reverse direction this time. Given that some of the folks in the audience may have heard from some of the pharma companies represented today, business development groups, their early stage efforts, and so forth. They've heard from conventional venture groups also in some of the panels. You know, why should an audience member, why should an entrepreneur come to a corporate venture group? How do you, within the parent corporation and the other groups represented here, how do you differentiate what goes to the corporate venture group versus a partnering group within Merck in your case, etc.? Just provide a little bit of context that might be helpful to the audience.
So it probably depends on who you talk to and which stage you are. If you're very early stage, then probably... Oh, better? Now? Oh! Usually I talk too loud, so I'm not used to keep lost. That's the same for me. Where was I? So it depends probably on your stage. If you're very early stage, then probably you should not differentiate where you get the money from, because it's about solving very critical issues in the development path of your company and creating value for your shareholders. If you're a later stage, you also still want to create value, but you probably have a strategic angle. Probably think there's a benefit talking to a corporate investor. So, and then you have to differentiate on the second level is what type of corporate investor do you talk to? For example, we are completely independent from Merck. Although Merck is our only LP, we are probably in a similar position like SR1, that we are basically a venture fund working with Merck money, and only in the initial decision, if we make an investment, the strategic play plays a role. But later on, we do pure return-driven equity investments. But if you talk to other venture arms that have a bit more of a strategic link, then they could open doors to the parent organization. So there's not a clear-cut answer to that. So if you're late stage and you could already see a commercial play happening, then probably business development is much more straightforward than venture investment. It's at least my personal experience.
Elaine, Pfizer Ventures versus other parts of the organization?
Well, although we invest off of Pfizer's balance sheet, so, but we're very, very careful about the firewalls we keep between the companies we review and that our business development or R&D colleagues review. So for example, if we have a confidentiality agreement with your company, it really only covers the discussion we're having about investment. If you're interested in seeking a collaboration, then you need to have a completely different CDA in place with the R&D group that will be evaluating your opportunity. So we really try to keep our houses very separate and very clean between one another. But I would say that at Pfizer, if you're very early stage, We have a very active business development group. They see a lot of great opportunities. We often get referrals to companies that are very exciting, but just a bit too early for an actual collaboration to be effective at the moment. And in those cases, the equity strategy makes a lot of sense. We can co-invest with other financially oriented investors, or frankly, we've co-invested with almost everyone on this panel with the exception of Cipla, because I don't think we've seen things that have been in your space, but probably be interesting to look. And in that case, we together, along with accessing our R&D experts, can help you think about strategies and approaches that you might want to take your business in that would be interesting to a pharma partner at a certain point in the future. And so in addition to money, we think we bring access to our experts. And believe me, one thing that Pfizer has is 5,000 experts from R&D to manufacturing to regulatory, et cetera, clinical. So that is, I'm sure every corporate venture would say the same thing here, but that's our special sauce. We just don't write a check. We also can bring you some insight and expertise to help you advance your programs in a way that makes sense to accrue value to your company in the future.
Thanks again. Vikram, I mean, you wear a number of
I had a
hats.
question there, but.
Oh, there's a question?
I don't mean to interrupt, but I just wanted a clarification that certainly not challenging you, but I don't quite understand what you just said. You're separate, but you're the same company. Do you get approval from the R&D people before you invest in a new technology, or do you go on your own and do it? My awareness of some of the things you've done doesn't quite fit some of the things you said. And I'm just trying to get it from within Pfizer. Now, I see him shaking his head, but SmithKline separated from SR1 some time ago, and they've been back and forth, but you're totally separate now.
No, we
GSK.
are part of GSK, but I mean, and we can clarify as we go through. We'll have a question on the investment decision-making process, so how much involvement of the parent corporation is there or not. But that's certainly a very relevant question because...
Well, it gets complicated because when GSK gave up neuro and others give up whole areas of technology, and they're relying on small companies to come up with the new ideas and new technologies. So when you find one of these that you find of interest, maybe you used to be at Pfizer in a particular therapeutic area, and you get somebody, do you really keep it to yourself, or do you go back and try to get them to support your support of this new company? I'm just curious about how separate you are from internal R&D.
It's complicated.
On purpose.
It depends. So, and I'll be quick. The Pfizer venture investments, we don't report through R&D. We make an independent R&D. We make an independent investment decision about our targets there. We are informed by evaluation that we ask our R&D colleagues to help us with if our target company is amenable to that. If not, we use independent consultants to help us review. But it is our decision. We have a very smooth and fast process. In the case of R&D Innovate, the second equity pot of capital, that is intimately tied to R&D alignment. So if we cannot find an R&D champion, then we do not invest using that pot of capital. So again, big corporation, many doors. That's part of the issue for all of you here, probably is trying to find the right one for your particular company at the right time.
Thanks. And we'll see different flavors of organizations here, represented here and in general within the corporate venture community, some that are very closely aligned and some that are not. But yeah, Vikram, maybe you can provide the Cipla perspective because you do wear many different hats, and then Vijay, you can also answer that question.
So we do things very differently at Cipla, and to Elaine's point, we actually almost syndicated with you on an investment through Barbara, but we have a very lean decision-making process in Cipla. It's about 8 people. On most of our investments, we do an ad hoc investment committee. One we think actually makes sense to assess the investment. So from a medical perspective, regulatory perspective. But to Elaine's point, I think a corporate venture actually tends to add a lot of value. We tend to be, depending on the stage of company, as tailored our involvement as much as the company needs. For example, for one of our portfolio companies, we formulated the product for them. We were trying to make the combination work. We helped in actually bring in our IP folks to help grow the patent estate from 1 family to 5 families. So we do a lot of things like that. And the other thing I think that we do a little bit differently is if it's a very early stage company, we tend to get more operationally involved as well. But it really depends on our co-investors who's investing alongside us. We like partnering with venture capital. Even strategics is great for us. We don't have bells and whistles, but we like insight into what's happening at the company so that if it becomes a strategic interest for Cipla, then we should go in and make an offer on the company. And the commercial side of thinking, how to tell that value story, especially in a very rapidly changing commercial environment. I think the company brings a lot of value. For most of our portfolio companies, we write the global pricing and market access story alongside the company. They don't have to do it for themselves. So we think through all of these things in our investments. And I can give you some specific examples.
Thanks. Vijay?
Great, thanks. So there are a lot of similarities and differences with J&J. So like Pfizer, J&J is a very complicated organization, much like every large healthcare and pharmaceutical company. But one thing that we tried to do in our kind of coherent and consolidated approach to innovation is to kind of make that simpler for you as an entrepreneur or a venture capitalist. So our global head of innovation has a nice story of the big red doors. So there are 4 of them. One in Menlo Park that supports California and things west of the Mississippi. One in Boston that supports things east of the Mississippi. One in London that's all European opportunities, and one in Shanghai for everything in Asia. So the idea is you just have to knock on that one door, talk to any of us, and we'll work together to find the right deal structure to work with you. So I work closely with our collaboration colleagues on early stages. You don't know whether something's an equity investment or BD or collaboration opportunity. Let's talk about it non-confidentially together, see what makes sense. We kind of get a bit more traction there, and we think, well, this is going the equity direction. We want to put a CDA in place. We'll have that, much like Pfizer, just with JJDC separately. We are structured as a separate New Jersey corporation, and we hold the information you share with us. So, cap tables, valuations, things of the sort, separate. We hold that in confidence with just JJDC. And I'll just talk about that with my committee, which is JJDC investors, and our legal and finance group, which only supports JJDC. We'll involve our R&D colleagues for, looking at, doing diligence and evaluation, because it only makes sense to do that. We are looking to be strategic investors. We invest in specific areas of interest to the organization, so why not leverage our folks internally for that process? And we certainly talked to you about kind of how we would embark on that procedure together. So then once we've decided to make the investment, that firewall stays in place. So all information at the board level that's shared with us, we keep that and retain that separately with JJDC. We don't share with our R&D colleagues. We're certainly happy and eager to provide introductions as appropriate to our folks in development, regulatory, manufacturing, other places to help provide free consulting expertise. Most of our portfolio companies have benefited and actually been actively seeking that, and so that's something we're happy to do, and that will be under a separate CDA. One needs to be put in place between the company and our YANs and our appropriate groups internally. And a lot of the investments we've made, one is an example of Protagonist Therapeutics, based up in the Bay Area. We were early investors there. We kind of provided some input as they were kind of advancing products to the market. We supported them at the IPO, so we invested there as well. And then, they've done very well as a public company. And then just a few weeks ago, we announced a collaboration opportunity with one of their programs, and they still have leads as well. So the market responded well to that. This is kind of the way we like to work. We kind of work collaboratively across J&J in our innovation ecosystem, but we compartmentalize information appropriately so we don't, share things that you might not want to share with a BD colleague. When our BD colleagues love to know how much cash you have in the bank or your pre-money evaluations, but that's not something we would do.
So,
And
just
I guess we'll talk about kind of how we review things the next question.
So just one more data point along the question that was asked. So for us, we also have a firewall between us and GSK, so we don't share any confidential information that you might provide with GSK unless you agree to share that information with GSK. We invest both in areas that GSK may have an interest in or is involved with at a particular point in time, but we also invest broadly in other areas that GSK may not be involved at this point in time. So in that sense, while we're part of GSK, we're not constrained to only investing in areas that GSK might be involved with at a particular point in time. And going back to changes in strategy, we think much more longer term, as we know a lot of, including large companies, change strategy every few years. we try to be outside of those boundaries because the venture investment game, the company life cycles are generally longer than the strategy life cycles in probably most of our companies, I think. So we think, as investors, we tend to think longer term. So once again, just focusing on some basics that might be helpful. Maybe going back to Vijay, we can chat about a little bit of the decision-making process and specifics starting from when you get an email, or a phone call or some other form of communication. How should entrepreneurs approach you and what happens then? And also maybe helpful to the audience to discuss some do's, like one do and one don't, maybe from each of the panel members, specific examples if you can, that hopefully will be helpful.
Perfect. Yeah, thanks, Rajiv. So as one kind of do, as a strategic investor, please look at the information on our website and kind of our areas of interest, because we don't invest in pure play digital companies, or we don't invest in areas outside of our 5 therapeutic areas in pharma. So I get inundated with something in antibiotics or something that's completely orthogonal to what our strategy is, and we're very clear about what we will and won't invest in or do a collaboration on. So just do a little bit of homework on pretty much any investor, and that's kind of, I think, going to be a universal theme. Kind of know your investor and kind of tailor your email or your pitch to them. Maybe you can kind of come in through someone that we've worked with in the past, as always helpful as well. So in terms of how it works, we'll look at a fund, a traditional venture fund. So it comes in through non-com, you'll have a discussion, kind of involve R&D colleagues. It's a bit of a separation. One piece that's different is we have strategic scientific alignment done early. So once we have under CDA, we kind of see, okay, strategically, what are you guys going after? How does that align with our scientific interest? From that point, we look a lot more like a fund, so we kind of check that box. And we have, every 2 weeks or so, we have investment committee meetings where I and the other investors sit. We make decisions at that level about how much we need to invest. We don't need to go back to our, senior management for those types of investment decisions unless we're talking certain pipes that we do, which are $50 million. We don't have the approval to do that without going out to hire folks. But from like a traditional Series A, B investment, we can kind of just decide at the investment committee level once we have that strategic, internal champion for that.
Thanks.
So the decision-making process at Cipla is very straightforward. Like I'd already mentioned, we have ad hoc investment committees that are set up. The investment areas, if you want to call it a do, are really important for us. We have a lot of expertise in CNS and respiratory. So that's where we tend to prioritize our focus of very large indications. We work traditionally like you would do with any other investor, so confidential information. We typically review that within a week and get back to you with a sense of whether it's interesting for us or not. We have typically the review process within Cipla will go through medical, we'll go through R&D, we'll go through formulation, and we get very quick feedback, and IP is always involved in any, even a non-confidential pitch to us. So that's how we look at opportunities efficiently, quickly, and triage those that don't meet our requirements. I think the other thing to keep in mind, especially about Cipla, is that Cipla is a little bit different from more of the mature branded organizations around here. So we tend to be very flexible in how we interact with entrepreneurs. In terms of actual investment sizes and stuff like that, Cipla is very agnostic. It really depends on the opportunity. We have a rock solid balance sheet, so we invest really off of the balance sheet. And more often than not, we'd like to syndicate with venture partners. So if you do have active investor interest in the company, I think one of the nice things to make it more efficient for us is to let us know quickly, because oftentimes we find that too late as they try to play off one investor against the other, and then it just gets too messy for us. So just letting us know that there's interest from elsewhere actually will enable the process to be more efficient for us.
Lee?
So I think Vijay gave you some equally good advice for approaching Pfizer. Study up. We have very clearly stated the research areas of interest for us on our website at Pfizer in the business development section. So I had quite a few anti-infective requests here. This is not an area of interest to Pfizer, so pretty easy to decline that invitation. But again, if you want to get it seen, it would be helpful that it maps to areas of interest to what the corporation is doing. Do be persistent. We don't have the same amount of staff that some of our other corporate venture groups have, so you have to keep knocking on the door, and I would use every networking opportunity you have, whether it's your banker, your attorney, your accountant, to try to get to me personally, or one of our team personally. Our process begins with a non-confidential review of a slide deck, and if you get through that, then I normally take a 1-hour phone call so you can take me through your business plan. And what I think many entrepreneurs neglect in that first hour is to talk about the business milestones that will be achieved in the financing that they are proposing. They spend 60 minutes on science and 0 minutes on how much money will be raised and what it will actually be transformed company where it is today and where it's going to be at the end of that financing round. So I would really encourage you to think about it in bite sizes, how this amount of cash gets my company from A to B and the next amount from B to C, et cetera. That's how we think about it. And I'd like to suggest that those milestones be very clear, bright line milestones, very easy for even someone who doesn't know what the heck they're talking about to say, like IND file or something like that, that is very, very clear, cannot be argued with you and your other investors. Our decision process is pretty quick. In both cases, we have small committees that meet, in one case, weekly, and then on the other case, monthly, but we can get to them at any time. We can make a very rapid decision and decide if we're going forward or not. In the case of R&D Innovate, however, we do have this Chief Science Officer endorsement. That often probably takes a wee bit longer, but we can move quickly. And we can co-invest with most other investors out there. So the fact that you have one corporate interested does not mean that other corporates won't be interested in co-investing alongside you.
Can I ask a quick question on that? So you mentioned that twice,
Yeah.
Elaine, about co-investing with other strategics. Is there a preference at any time to be the sole strategic if a syndicate is involved?
Wouldn't that be lovely? Certainly. I think in many cases, for early stage platform deals, I've really found in syndicating, first of all, we only invest with we never invest by ourselves. We're always a member of a syndicate. And lately, in the types of platform deals that we find very attractive, corporate investors are the guys who are prepared to come in early alongside us, because it takes a while to establish a platform, demonstrate what its yield's going to be, to see if you can actually generate drug molecules or biologics that have the desired effect. And depending on, I guess that would be different for SR1, for example. We don't have a 10-year fund life. We can afford, we're certainly interested in making a financial return. Please do not misunderstand my statement here, but I think we are also interested in great science and setting up strong platforms, so we can be a wee bit more patient at thinking of opportunities. But yes, this is a capital-consuming enterprise. You're all in. And what we like to do is invest with people who have a lot of capital, who understand how long it takes and the vagaries of drug discovery and development, so that they will have enough capital to be there for round 1, round 2, et cetera, whatever it might take, as long as the company is making strong forward progress.
One quick following question. Do you guys find yourself in a position playing early and some strategic considerations a little less price sensitive than normal venture investors?
I'd like to say no. I'm sure we have been a little bit more flexible in some cases, but I would just say, if we're going to go in early in a platform where it's going to take 3 to 5 years, you should not be expecting a valuation that is high at all, because we're thinking about what's the end. If it's going to take $30 or $40 million, by the time you get to a $50 million post-money valuation, you better have some pretty darn nice data to defend that for the next financing round. So I think we're not thinking about necessarily the buy-in price, but where you're going to be at the end, what the value is, and can we defend that when we go out there to write another round.
So Andreas,
Sorry.
It's very hard for me to add anything to that because you said it all.
I'm sorry.
But maybe I can summarize.
Please, how about reinforce?
Yes, I can try that as well. So Merck Ventures works very similarly. We're also independent. It all starts with a screening process to get the technicalities right. If you send me a business plan for a Series D, then I don't know what to do with it. We finance along all the series of the company, but we go in early. So we like to see seed, maybe even pre-seed, classically Series A. We like to syndicate as well. As any of my colleagues, we start with a non-confidential review. If we like what we see, if it fits our criteria, if it fits the strategy, and we set up a call, and the call is very important. The call really defines how much time we will spend on a case. It's more of a gut feeling. It's hard to explain, but all of us know that. You hear something and it intrigues you and you want to hear more about it. So don't underestimate this initial call and be prepared for that. We have a lot of those calls, so use that time very well. So talk about your science, make sure that we understand what you want to do and how you want to do it. But as mentioned before, also make sure that we understand what you raise the money for, because at the end of the day, you want to have money from us, and we don't need a second PhD. So it's very well and also appreciated that we understand the science, but at the core of it, we have to understand what we do with the money, how do we build value. Then along the evaluation process, what we usually do is we then start something called a pre-due diligence. We basically start reading the papers, which usually should start before the first phone call, but usually it starts afterwards. So you really dig very deep into the science and maybe call a professor here and there, maybe you know somebody in your network. And if it still looks good, then we look for an internal sponsor. So at Merck Ventures, we have an internal sponsor requirement. And it sounds very formal, but in practice, we only ask somebody within the leadership structure of Merck that understands the field and also business. Is that something that one day could become part of Merck, maybe through a license, through a collaboration, through an acquisition? But this is very non-binding. There's no commitment whatsoever. And we don't talk about pre-BD preparation here. We talk about a very visionary question, like one day, 5-10 years down the road. Because if it's already tangible, then usually we have the gentleman's agreement that the BD colleagues will take over the deal, because it doesn't make sense to put venture money into a deal that business development can already do. So if we have an internal sponsor, we do a proper diligence like any other venture fund. During the diligence process, we can recruit internal experts as consultants. If there's conflict of interest, we use external consultants. We always align with the companies about that. Then it's always confidential, and the internal consultants would be under the same CDA as we are, so they are not even allowed to talk to anyone in the organization about this diligence process. It works pretty well, and we are usually more careful to not contaminate the organization with outside IP. It's not so much about stealing, you don't have to be worried that a big company wants to steal your IP. It's much more the danger for us that we bring something into the organization that could block us from working on it. So at least this is our internal view. And once the diligence process looks very well, then we go in front of an investment committee, and in the case of Merck Ventures, we do have an investment committee that also consists of people from the organization, but from leadership, so not operational, but we do want to make sure that we have a buy-in as well, that down the road there's at least the idea of an acquisition or a collaboration with that company. After the investment, however, we are purely financially driven. So we only need the strategic buy-in initially. And so if our strategy would change down the road, so Merck says, okay, we don't do whatever ophthalmology, we've never done ophthalmology, then we would still stay in the company, we would still invest in the company if it looks good for the return. We are an evergreen fund, if we don't generate returns, we can't invest anymore. It keeps it very simple.
Thanks. So maybe I'll summarize a little bit more, but just one question that may be on some of your minds. Do any of these companies take rights as part of the investment? So just a simple yes or no. Andreas?
No strings attached.
No?
Sometimes we took some India market rights, sometimes, mostly not.
I'd say not necessarily. We do it if it makes sense for the partner. So we work with our collaboration colleagues if it makes sense to structure a hybrid equity / BD deal. We're happy to do that. But most of the investments we do are straight equity only, no rights.
So I think as you're hearing here, and this has evolved over the last 10, 20 years or so as corporate venture capital in our industry has evolved, but certainly you see a lot of groups working with each other as co-investors, which might have been competitors before. And part of the reason is most groups do not take rights into their companies that they've invested in, so they can work with other corporate venture groups and so forth. And then I think what has also evolved is, I think as Elaine had mentioned in one of the questions, I would say certainly when I started in the business, I was seeing some of this, but 20 years ago, the conventional venture community in some ways viewed the corporate venture community as stupid money coming in, at high valuations and so forth. That is definitely not the case now. While you may see some of that, but in a lot of cases, we may even be more stringent than a conventional venture group. So we're certainly sort of venture normal in terms of valuations, because I think most of our groups, if not all, are financially driven in addition to the strategic component in terms of investing in good science, investing in science that may be applicable to the parent company and so forth. Is there a question?
Yeah, just following up on the working together, do you guys invest in fund of funds?
So we can go around, I think there might be some that do, some don't. We used to on the SR1 side, but very selectively. GSK does also very selectively. It's not the norm, but occasionally, well.
There are some historic commitments to funds from the operational side that we also manage, but Merck Ventures itself does not conduct any fund-of-fund investments.
Again, historically we have. Currently we are doing very little of that, but the parent corporation does do it on occasion.
We don't.
I'd say similar to the other folks, historically there are certain things there, and if it makes sense, we're happy to think about it, but it's not really our core. I mean, our mission is direct investments into new companies.
Question?
When you go into, decide to invest with an early stage company, is there a minimum amount of that company that you're looking to get with the equity? Do you have a minimum? Is there a range there that works for you, or something that would break the deal?
Vijay, you can start.
You're saying in terms of equity ownership we're looking for out of a company? No, I've seen us take a full gamut of things. Obviously the valuation has to make sense to what Rajiv was mentioning before. So for us, financial returns are important. We've invested a significant amount of capital. We show capital appreciation that's important for our CFO to allow us to continue to invest. And it's also good for us as we go into rounds with traditional venture investors. Right? It's not good for you. You raise like a large round of quote unquote what used to be historically dumb money. Then smart money comes in and they're drive down into a down round. That's not good for anyone. So that's not what we're looking for. To Rajiv's point, we're venture normal how we view things. So with that valuation set, the dollars just kind of flow into what we get.
Same here. There's no minimum from our side. Obviously, we'd like to own as much as possible. At the end of the day, we also think about our investments as financial investments. I can give you one very quick example. Our most recent exit, and this illustrates how Cipla thinks a little bit differently. We like repurposed drugs actually quite a bit. A lot of pharma doesn't tend to do that, and we like specialty drugs as well. So we did a $26 million syndicate about 2.5 years ago for an Alzheimer's company, so 99.6 failure rate. So we are willing to take risk, but we really like the science a lot. So that's what attracts us most to our investment, is how attractive is the science. So we did a syndicate with Rothschild, with former head of M&A at Novartis, put that together, saw them through a successful phase 2A clinical trial. We invested in two 70-year-old and 80-year-old founders. So we didn't have an operational team around that, so we had to put it together. So we're very, very different. And then when things started looking good, we hired the former president of Allergan to come and be the CEO of the company, and we sold it at $1 billion exit. So 2.5 years, 40x on the return. We did about 8x on our first up fund. So we'll do what it takes from our side to help the company.
Yes, we do not want to own more than the famous 19.9% of the company, because that results in different accounting treatment of Pfizer, so we're very sensitive to that. The bite size is typically $5 to $10 million on a first investment round, but honestly, we consider ourselves active investors, so we're putting the amount of capital it takes to get some type of board representation, whether that's as a full director or as an observer. But that's pretty much a bright line for us, not more than 20%.
Actually, same for us as well. When I say we'd like to earn as much as possible, but we can't cross the 20, otherwise we have to consolidate.
I'd say that hasn't been, we have ways around that, where we've been willing to invest. We've been willing to invest to take more ownership if it makes sense to do that. So not that we are looking actively to do that, but it hasn't been a constraint for us in a lot of our
We have a practical lower limit, so below 5% it usually doesn't make sense, because we also ask for board seat usually, because we're also active investors. And it's also the classical ticket size is the 3 to 5 million in an A round to join a syndicate, and then it usually defines also the chunk that you get. So we're all playing in the same bracket, I would say. We can go above 20%, because it always makes sense. Probably not. If it's a very early stage deal and you know it's going to be expensive later on and the big tickets will dilute you, then it might make sense to go above 20%, but usually not.
And for us also, ticket size about up to 10 million in any one round generally, but we can go over that. I'd say 80% of our companies are sort of in the 15 to 20% ownership range, but for earlier stage investments, those we've seeded, we may be in the 30 to 40%. So it's good from one sense, from the entrepreneur's perspective, right? If we don't want to go over 20%, that's good from a valuation perspective for the capital you're getting in. So, any other questions at this point? Doesn't look like it. So maybe just once again, in terms of what might be helpful to the audience, criteria that you look for, and as you go through the investment decision-making process, what are the key things you focus on? Certainly, you mentioned folks should have an idea of what you invest in, but assuming it falls within your scope, Andreas, do you want to get started?
It's very hard to be specific on that one, but stage obviously. So we look for very early stage. We're an evergreen fund, so we have time. This was already mentioned before. I worked in traditional, conventional venture before, and there you always have the runtime of your fund in your mind, because you don't want to start a fire sale. The huge benefit of being part of a corporate venture organization is that you can go in very, very early. You can start and help building a company. So we're also looking for that. If something is an idea and very good science, it could change how the field conducts science. In my case, I don't invest in drugs. I invest in anything that enables drugs and the development of drugs. So if there are new technologies that enable new drugs, I'm willing to go in very early, and that excites me. If it's something that is an incremental benefit, it's usually not the right thing for venture, in my opinion.
I think in our case, we're going to assume the science is going to pass muster. So then it's all about the team who's executing on the plan and what expertise they're bringing to the proposition. Have they done that before? If they have not, have they surrounded themselves with very knowledgeable mentors and advisors? Have they thought about what a success scenario looks like, what a failure scenario looks like, how are their plan Bs and Cs? Again, a crisp business proposal to match the scintillating science that hopefully they're presenting to us.
Yeah, I'll reiterate what I said before. CNS and respiratory indications are really important for us. We really like repurposed drugs with or I would say known drugs with known mechanisms of action. Whether approved or not, it doesn't matter. I think the number one step is the science. Everybody will say that. It has to pass muster there. But then we also like companies that need our help. So we feel like we're doing something alongside them, not just a financial investment. So if we can make a drug for you, which we've done very successfully in the past, or if we can help you build your IP estate or develop a commercial story, if you're early stage, we're quite happy to do that. In fact, we take that on as a challenge for us with individuals.
I would say a lot of alignment with what Elaine said. So assuming the strategic alignment filters met, we're looking for really compelling science, right? So that's, transformative science is imperative for us. In the past, I would look for a great team. It's fantastic. Their experience has been there before. They've kind of succeeded. You know how you put a Series A in. Often as a company stay that same course all the way through their exit, right? Often there's some pivoting required. So I have a team that you feel has the ability to do that, either having done it before or have that promise. Great scientific advisors, those types of things, and kind of like the concept of having the clear value inflection milestones laid out, not only for that round of capital, but beyond that. So, phase one, where do you see the real value inflection milestone for this opportunity, and kind of making sure we understand that. For us, we are stage agnostic. We'll do mostly seed and Series A's. We've done our own company building efforts. I'm on a couple of boards in Boston where hiring the full-time team in and rolling up your sleeves type of stuff and doing things like deciding what insurance plans to choose. So that's things we'll do, but that's not our, I would say, our bread or butter. Mostly more Series A's where there's an established company. We'll also go beyond that, VCs, depending on the opportunity, happy to invest later. And then in terms of stage of an asset, You know, while we like platform technologies, we need to have kind of an asset to help crystallize a conversation with internal stakeholders. So for us, I'd say probably the earliest would be 12 to 18 months before an IND, maybe 24 if it's something particularly compelling. But you know, we need to at least see a statue in the stone, as it were. We can't invest in just a big platform technology, which 3 to 5 years to see how things work out. Probably wouldn't align so well with our investment strategy.
Thanks. And certainly, I've seen evolution in the venture space, having worked in the industry for over 10 years. But I'll bring up our dreaded R word, reimbursement, even for early stage companies where traditionally 10 years ago, et cetera, when an early stage company used to present to an investor, there's no mention of it. Now, maybe it'd be helpful to hear from the panelists. Is that a consideration? I mean, certainly, none of the details will be sorted out, but how much do all of you, the panel members, think about that in making even an early stage investment decision? Vijay?
Yeah, thanks, Rajiv. I mean, it's certainly something we think about. So we'll, for a lot of the opportunities, we'll involve our commercial colleagues, help us think about how things might look, especially if it's going out of the area where they're seemingly it's being well served already by medical treatments, where especially how is it going to evolve in 10 plus years when this opportunity is there. So certainly we're thinking about that.
So because we're very drug focused in our efforts, we don't do medtech or platform technologies. Reimbursement is really important for us in our evaluation. And the way we think about that is, if you don't have a good reimbursement story to tell, how are you going to get acquired at the end of the day? So I think we like to really develop a line of sight at the very least. If a company comes to us with a hypothesis, we'll build on that as part of our diligence. So, typically we could do our own reimbursement work, and for companies that have pitched to us, about 5 of them, we would commission our own. So we'll cover about 50 to 100 million US lives, and go and get that reimbursement story done and get a KOL opinion done as well. So that we can punt that to cost of diligence. But we need to see that reimbursement story. For our Alzheimer's drug, we were essentially trying to improve an existing Alzheimer's drug. It's not generic, right? So most pharma won't touch that, but we actually felt there was an extremely strong IP case around it. And we did our own commercial diligence with payers, and we came back fully understanding how we would price what form of replacement here. And we had a lot of visibility on that before we actually put it on.
Code.
I'd like to say, and we do have orphan drug companies that we've invested in, but if you have to rely on a $250,000 price point to make your investment thesis successful, I think that's probably problematic. So I think, so we think about it, Rajiv, but I think more critically, we're thinking about what's the clinical development strategy that you would be using to show proof of concept in man. And is there a small indication that allows you to show that you have an effective and safe molecule, but that can then springboard you into a larger indication? And then your pricing strategies, I think, follow from that. But I think it's not so much, it's reimbursement, I guess, is involved in that, but it's really about how do you get to a clinical and a regulatory path that makes sense for that molecule and its indication.
I'm a bit the outlier because I'm a non-drug investor, and we talk about customers and not patients, and for us it's very important to understand the market validation. Who would buy it, why would they buy it, what would be the pricing, what is the differentiation, but it's basically the same thing. How do you get to the money?
So we have, I think, a couple of minutes left. Any questions?
A little bit of a regional question. I saw JJ has several places, but are you focusing on your region? Are you focusing on Europe, for example, with Merck? Are you focusing on the United States with Pfizer, India, or are you open to look at other opportunities as well?
So we're global. We look anywhere and everywhere for innovation.
We're global as well. We even have offices in Boston with an incubator in Israel, so we're globally active.
Yes, we're prepared to invest anywhere, although I'm on an airplane every week, so yes. I don't just do my Sand Hill Road investment strategy, that would be true.
We're global as well, but we have a U.S. lens, both from a clinical and commercial perspective.
So we're global. I focus in the U.S., but my colleagues, canvas the rest of the world, and we invest actively everywhere.
Maybe one last question. If not, maybe a parting message or thought for each of us, or either a do or a don't that might be helpful to the audience members to work with your groups.
Yeah, so, we, as part of our Johnson & Johnson innovation strategy, we're very open and interested in having early conversations with you, kind of as part of our, reaching out to the innovation ecosystem. So, please feel free to reach out at any point to me or one of my colleagues, and we'll kind of sort things out and kind of have a conversation. A lot of things we look at might be too early, but we want to provide some substantive feedback so that, maybe in a couple of years or a year, you can come back and there's an opportunity for us to do a collaboration or an investment. A lot of things we've done have actually gone that course where it's not ready today, but we kind of provide some input that the company sees as value adding, because it's not just us, J&J, it's what a lot of other pharma companies might be looking for. The company comes back and it makes a lot of sense for us to take an investment in closer look. So happy to have those conversations earlier. So feel free to reach out to me or one of my colleagues and have a discussion.
Yeah, we like to meet our companies, even if they're pitching to us early stage. So we'll make the time to meet with companies, spend a few hours, sit down, hear the story. The non-confidential tech only takes you that far, and we really like to meet face to face. So find us, and we'll make the time to meet you.
We have only a few people in the venture side, but we have quite a large number of people in our external research and development initiative group, innovation group, and you can come in through any of those doors. Like I think Vijay said, we'll figure out if it's something of interest and then how we want to move forward, whether it's collaboration, investment, both. So I think that's my advice. If you want to talk to us, keep knocking and try to find somebody that you can talk to, whether it's a venture person or a licensing person.
Same for us. Come early, talk to us very early. We can do even pre-seed. There are no hurdles, no formalities. As long as we understand what you want and what you want to raise funds for, it's fine.
Great. So I only went through half of my questions thanks to all of you, which means that this was a highly interactive group, even this late in the afternoon. So hopefully this session was informative, and I'm sure at least some, if not all of us, will be around at least for a few minutes. Thank you.